have a seat. And I would also like to invite Katja, who is our youth engagement officer. Welcome, Katja. Very nice to see you here. And Mayor, thank you for also hosting us. I think you can see that we are all delighted to be in Reykjavik, and we are very touched by your hospitality. So thank you very much for having us here today. I'm going to take a seat because, of course, we want to now have a bit of a conversation. And I'm going to start with you, Mayor, because we've just heard a very powerful story. We've heard two powerful stories this morning. One from Copenhagen, which touches more on the food systems and how you built resiliency through more day-to-day manner, so to speak. And then we've just heard the story from here in Iceland, where it's very much about a natural disaster and looking at working with the community to also shape that response. So with that in mind, Mayor, I know that you've also really dedicated your career to fostering inclusive and sustainable communities. So reflecting on the stories that we've heard this morning or this afternoon, how did the city of Reykjavik and other towns play in the response to this? And what lessons can cities take forward to better prepare for future natural hazards?
Yes, thank you. And first of all, really warmly welcome to Reykjavik. We are happy to host you here and hope you have a wonderful time. We have emergency plans for almost everything regarding nature. I think we are better in that because we live in this island. One of the professors says that this island is always trying to kill us, so we have to be prepared so it doesn't succeed. So when this happened in Grindavik, the municipalities in Reykjavik area, we worked together on at first, like receiving those people who are there. It's almost 1% of the people who live in Iceland who had to evacuate their homes. And we don't have a lot of free homes or free houses, so it was challenging. And as you saw, the people were, of course, terrified, and it's a situation that people, you don't know how you feel until you feel it. So we also took care of that. So we offered the city council of Grindavik to come into our council house, and the mayor was also in our house, and their administration for a while, because they were homeless. I mean, it's like, and this happened really fast. But like, I'm born 1971, and can you guess how many volcanic eruptions have been since then? What would you think? 28. Oh. So it's like we are kind of like, it's kind of part of living here, even though it's usually it's 5 years interval between this. But yeah, we have earthquakes, we have volcanoes, we have the snow sliding from the mountains, we have the water coming up, and we have to be prepared. And we are working more and more in that, in a municipal level. Also, so our people feel safe, and they feel secure, and they know that if something happens, we have a plan.
So you have a plan, and you have had 28 volcanic eruptions in what I would say your relatively short life. So that really speaks to resilience. So on that note, perhaps, Katja, I can turn to you, because of course you are the project associate at the Slovenian National Institute of Public Health, and you're also the coordinator for the Joint Action PreventNCD with youth engagement effort. And you have also dedicated much of your life to ensure that that we address the inequity gap, but that we also foster sort of inclusive communities. And with that in mind, and what we've heard this afternoon, from your perspective, have you sort of seen similar examples of local resilience, and what would your insights or ideas be to carry this out in the future in terms of preparedness?
Yes, thank you for the question. And while my country, Slovenia, is way less geologically dramatic than Iceland is, we still deal with a lot of other extreme weather events, especially wildfires, heat waves, and I want to focus on the record-breaking floods that we had 2 years ago in the summer of 2023, where 2/3 of our country was actually affected by floods that we haven't had in several centuries. So that meant that we had more than 8,000 people displaced, several millions of euros of damage that we are still rebuilding up to this day. But one good thing that came out of it was the community response. And that is because the government and the agencies work together with the communities and the NGOs. And one really great example that we have in Slovenia is that we have a huge firefighting scheme for volunteers. And children can start as early as in elementary school, where they start learning about different responses to not just fires, but also other emergencies. And we have over 160,000 volunteer firefighters in the country. And just for perspective, there's only 2 million of us, so it's quite a large percentage. And the response when it came to the floods was so big that the country was literally forced to build an app because there were too many volunteers that were trying to help. And we didn't have the capacity in the cities to actually have the influx of those volunteers then able to, help. So we had to get organized even better. And a lot of those volunteers were actually young people. And they came from not just the Firefighting Association, but also different medical students, pharmacy students, health sciences students, scouts, and so on, all helped in the response. So it was kind of a very, very holistic, comprehensive approach that used this intergenerational dimension to help each other. And then when it comes to these extreme events and emergencies, another thing that is important to say when it comes to young people especially is that they often take on the role of carers. And these are unprofessional carers that then provide caregiving to their family, to their friends, to their partners, and so on. So they play this additional role besides the one that helps the system or rebuilding the country. But it's actually built on what we have been talking about here, love and peace and togetherness. So I would say that what we need to do is to kind of carry forward from these examples, and we've seen many of them, like in Petrinja in Croatia when the earthquake hit, when we saw, the responses in Portugal when it came to the wildfires and so on. So we need the spirit of togetherness. We need to integrate social participation, especially youth engagement, as equal partners and collaborators in those responses when we design them. And last but not least, just to kind of go with the message that failing to prepare is preparing to fail.
Fantastic, Katja. And you've already started to talk a little bit about how you envisage the future. So perhaps if you can hold that thought for now, because I'd like to turn to the Madam Mayor again. You're, of course, also a member of the Healthy Cities Network, and we are very honored to have you as part of the political committee as well. And of course, Reykjavik is also part of the Wellbeing economy piloting that we are rolling out across the region. So I'm going to take advantage of having you here with me now, Madam Mayor, and ask you, what does a well-being economy mean to you personally?
For me personally, yeah, that's a good question. I think it's just, as a municipality, the measures that are often put on us is like, how is the finance going? Do you have any surplus, or do you owe a lot of money? Is it like, but sometimes not so much about how the people are feeling. Are they trusting each other? Are they taking part in organizing their surroundings, their schools, their community? How do they feel? Do they trust the institutions? How much time do they have to spend with their children? It's like all those things who really, really matter. And of course, my background is in nutrition. So that was my first intro to public health, because I was like, why are we not using the public meals I mean, like small children get 75% of their food in the kindergarten. Why are we not like securing that the food is good? And yeah, so I came in that way, but now I see it more like a holistic approach. And what I'm trying to work with, because we have this public health plan, and we have a green plan who is like focusing on the future of the Reykjavik. It's more that the people really feel that if you feel bad, that matters for me. Because our society is a whole, and we own it together. And I sometimes say this to children when they come to the city hall. It's like, you own this house, you know. This is your house. You own it, and what would you like to do with it? How would you like to change the society? And also, there was a homeless man I was talking to here on the street, and he said, like, no one cares. And I was like, of course we care. I mean, you matter. And just to hear that was like, really? And I think that is maybe the best way in the well-being economy, that we measure, like, do you feel that you belong? Do you feel that you are a part of the society? Do you have time to do what you want? I sometimes wonder, like, we have all these machines and more data helping us and computers, but we have always less and less time to do what we really love. And I sometimes, what are we doing with the time? Why wasn't this supposed to give us more time to like visit our grandmothers or grow vegetables or whatever it is that feeds you and recharges? So I think we have to involve our citizens more in that. Like, what is it that makes you happy? What is it that you really want in this city? And we have a lot of ideas, and we are always like talking more and more to the citizens. And it's not enough to talk. We also have to show, we have to invest in that. So now we are investing in more and more spaces where people meet, different groups meet. Because if you're old, or if you're newly came here as a refugee, and you're young, and maybe these people would never meet unless the municipality makes like a big library, a space where it's like just natural to meet. It's not like organized. Yeah, so you get people together, and we have seen that like with elderly people in Iceland. We were really homogeneous. I mean, even though we can also say when I was born here, there was no one who had not white skin. Like 50 years ago, it was we were so much all Icelandic. So for the elderly people, some of them have never met like people who are now. They maybe meet them, but they were feeling a little bit insecure about the immigrants and the refugees. But when we put the service for them both in the same place, it was so wonderful. Then you feel secure because you see it's just people, and they have their children, and elderly people love children. Yeah, so we can do a lot of things, and I'm really, it's like, so I think it's just a good society for me.
So time, trust and social connection, and you were certainly leading by example. And perhaps I can take this opportunity now because, of course, Madam Mayor has talked about, and you talked about it as well, Katja, about the future. So now that I have you both here, perhaps I can ask you, Katja, what are the top 3 decisions that you believe political leaders must make today to build a safer and more equitable future?
Well, maybe going from the definition that Ms. Mayor provided, the well-being economy is about shifting from, more to better, from quantity to quality. And maybe just to provide some example as to where I came from with my big 3, with the title of the session being from global to local. And to give you an example, a couple of years ago, I attended the UNFCCC Conference of Parties, and there were people running around doing videos where they were asking people, like, what do you want to see from COPs in 20 years? I thought that was such a weird question. And my answer was, I don't want to see any more COPs, because that would mean that we failed. And, you know, just kind of that mindset, like from the global level and then bringing it to the local, where the resilient cities literally don't build themselves, but you need inclusive decision making there, you need intergenerational solidarity, you know, you need all of these voices to kind of work together. And then integrating these aspects that make up the well-being, and that's what's important. So that brings me, like from those experiences, I'm kind of like trying to get to my big three. And they would be, the first one would be to invest in proaction rather than into reaction. The second one would be to guarantee meaningful youth engagement and social participation across all levels, and if possible, try to systematize it, try to integrate it and institutionalize it into whichever level possible. And then also to make health equity a core metric. We heard in sessions yesterday and today that we really like to measure stuff, but why don't we measure preparedness by how well we protect the ones that are the most vulnerable?
Thank you, Katja. And colleagues, I'm afraid that time is up. I think we've only just touched the surface here. I think there are many conversations that we need to continue. But I think one thing that we've really seen is that there is a lot happening at the local level, and we do need to be better at spotlighting those so that we can also inform the global level, because I think it's often said that whilst nations speak, cities they act, and I think we've just seen today that that is certainly the case, and I think it's our job to make sure that we capture those good practices. And as I just said, with the Healthy Cities Network in the WHO, we have just launched this database, so we actually have data, good practices from the 1900 cities that we are working with from across the region. And very honored that, of course, we have captured these good practices both from Slovenia as well as from Iceland. So with that, colleagues, I'd like to thank you. Madam Mayor, again, thank you for hosting us and for being so kind with your expertise and insights. And Katja, thank you for joining us and again giving us lots of food for thought. And again, colleagues, thank you for participating in this conversation. And with that, we conclude. Thank you.